Hello and welcome to Healthcare Cares. I'm your host, Trina Boyles, and today's topic for our community out there is what is the difference between an HMO? HMO, Health Maintenance Organization. What's the difference with a PPO, Provider Preferred Organization, or a deductible? So let me give you a head start here. Okay, so open enrollment comes up and you're saying, oh, I can only afford A, I can only afford B. So let me share with you what you need to do. So you look at HMO. HMO, you only have a copayment. Copayment can go anywhere from $25 a visit, and to a specialist, it can be as much as $50 a visit. But when you choose the HMO and you stay within your network and you pay your copayment, you shouldn't receive a bill in the mail, because that's all you're obligated to do is pay your copayment. And how do you find doctors that's within the network? Well, you can call your customer service rep. They can send you out a book with different doctors. Or if you have access to an email, they can email you their provider network manual. You can go through it and say, hey, these are all the doctors in my network. And then also, if you're already seeing a doctor because you have other issues going on, find out if that doctor's in network. And if the doctor's in network, hey, you want to choose him as your primary care. You want him to be the gatekeeper of your care. So let me remind you again, you have a primary care doctor, you're in the HMO network, you will only pay, I'd say, $25 per visit. And if he refers you out to a specialist, it can be as high as $50. So you should not receive bills in the mail when you have an HMO. Now, here's the catcher. Sometimes the HMO costs a little bit more. So look at your budget. Can I afford this coming out of my paycheck every 2 weeks? Or do I need to drop down to something else? I would say, check out, how healthy are you? Do you have some ongoing issues? Are you having a surgery? Are you pregnant? Getting ready to have a baby? And then speak to somebody. Speak to someone at the health plan. Or speak to your employer who's offering these benefits. And how much it's going to cost you. Yes, we know the premiums are increasing every day, every year, every open enrollment. But with the HMO plan, that's all you will have to pay. Now, let's jump over to the PPO plan. And PPO is the Provider Participating Network. You're saying, PPO, Provider Participating Organization. The difference between the HMO and the PPO, you can flip in and out of network. Maybe you see doctors already that are not a part of the network and you're saying, oh, well, what am I going to do here? Well, you will have an out-of-pocket expense with the PPO. If I was you, and this is just my suggestion, when you choose that PPO doctor or choose that PPO health plan, make sure the doctors you go to are within your healthcare network. Save you a lot of money. Because sometimes You'll go to a doctor. You'll get the bill. Why am I getting this bill? Well, most PPO plans will pay 80%, and you're responsible for the 20% because you have that PPO plan, and it gives you the flexibility of going anywhere you want to go. Also, with the PPO plan, you must know that you don't need a referral. You can call the doctor's office. Hey, call a dermatologist, OB, say neurologist, podiatrist. And with the PPO plan, hey, you can just make an appointment. But when you're making that appointment, you must remember that, hey, look, I know it's going to be a cost. It's going to be an 80-20. And so can I afford this? And a lot of people will say, I wish I would have went with the HMO plan. Then I wouldn't get all these bills in the mail. But again, some of us choose the PPO plan because maybe there's a doctor you've been seeing for your type 2 diabetes for a very long time, and he's not in the network. And you don't want to change. You like this doctor. This doctor has helped you out. You have a good relationship with this doctor. Okay, let me just remind you, there will be an 80-20, and you'll be responsible for the 20%. You say 20%? My bill was $150. Well, when they process the claim, that bill they may have billed $150. Look at your EOBs when you receive them in the mail. They will tell you what your coinsurance or your out-of-pocket expense would be with the PPO provider. Now, you want to go to this hospital. And you say, okay, this is where I want to have my surgery at. This is where I want to be. This is the only place my doctor has privileges at. But that particular hospital is not in network with your health plan. Can I go? Can I not go? Yes, you can go. But you must remember you're in that PPO plan and the doctor's not in the network. The hospital's not in the network. The anesthesiologist is not in the network. And the surgeon is not in the network. Therefore, you're going to get a couple of bills in the mail. So you might as well just prepare yourself. And if you don't want all those bills coming to you, work with the customer service representative at your health plan. Hey, I'm having knee surgery. If this orthopedic in network, a lot of times you won't know who the anesthesiologist will be until the night before the surgery and they call you on the phone. Okay? Now this hospital, they're not contracted with your health plan. So, again, you can ask, hey, can I go to a C hospital instead of A hospital? Because C hospital is within your network. So my out-of-pocket expense may not be as large, and it won't be if you go to someone in the network versus going to someone out of the network where your out-of-pocket expense will be greater. You must check on that at all times. I mean, there's times when, due to a certain illness I had, I would choose the PPO plan because I knew the doctor was not in network, but I had a good rapport with the doctor. Very good rapport. And one of the primary things I must tell you, always have a primary care who cares about your health. Always. So now let me move along. Okay, you sign up for the plan that has $1,000 deductible. It's a cheaper plan. It's less out of your paycheck every 2 weeks or every month. And this is all you can afford. So you're saying, oh gosh. You go to your doctor. And your health plan is not going to start paying for your doctor visits until you reach $1,000, because you have to meet your deductible first before the health plan start paying for your visits. So yes, you will be getting bills in the mail, and you want to check with your employer sometimes and say, hey, look, this deductible is $1,000. Is there another plan that I can go with that has a lower deductible? Ask the question. Don't be afraid. You're doing this for your care, not for their care. But for their care if it's your employer, because he wants you to stay healthy and come into work every day. But the key thing here is HMO, you'll have a copayment. There's no deductible you have to meet. Okay? With the PPO, you can go in and out of network. Now, with that PPO, you need to ask somebody, ask your employer, ask the health plan. Okay, I have an 80-20 and I'm responsible for the 20%. Is there any other out-of-pocket expense that I need to meet? They may say, no, that's all you need to meet. And then all of a sudden you get a higher bill, higher than 20% out of your pocket. Call customer service, call someone and claim. Let them know, hey, I was told that with this PPO plan, I would only be responsible for 20% of my bill. So what's going on here? Here's your catcher. Some PPO plans will say, yes, you'll pay 20%, we'll pay 80%, but you have a deductible of $500 that you need to meet first. Yes, you're thinking, I'm telling you, when you enroll into your benefits, ask as many questions as you can. I'm here to empower you to get out and ask those questions, because you may not have that money to pay out of pocket during that time. Now, you will find some providers that they'll let you pay monthly installments. Okay, well, then that's good too. But just think, they take $200 out of my check every month, bi-weekly or every month, and then I have to pay the deductible. The installments are $200. That's $400 out of your pocket. All I'm asking anyone out there, when you're choosing your package for enrollment, check at the cost, look at the cost. How much is it going to cost me to enroll in an HMO plan versus a PPO plan versus a deductible? Some people choose the deductible because they don't have a lot of healthcare issues. That's easy for them. Some choose HMO because they make frequently visits to their primary care office. And some will choose your PPO because you want to go in and out of network and don't have to call in for a referral when you go see a specialist. So take a look at your plans. Choose them wisely. If you don't understand them, you need to speak to your employer. Ask your employer, maybe you need to get someone out who can talk about our benefits, what is offered to you, or call the health plan. Say, I need to know these benefits. I have a serious crisis going on. You didn't pay my emergency room bill because it's not covered. Look at your manuals. Read your health plan manual to know what is covered and what is not covered and what your out-of-pocket expense will be. If you have any questions, take a look at my website on healthcare.cares.org or healthcare.cares.com. Check out my website. You can also check out my YouTube, or you can check out on my website my podcast that I do weekly. You have a great day. Take care of your health and rest easy.